Hi, I'm Dana Kapp, Pediatric Nurse Practitioner with Peacock Pediatrics. Today I wanted to take a few moments to discuss your 2-month-old baby. There are some milestones that can help us learn about your 2-month-old's development, learning, and behavior. Your infant should be smiling back at you now, making sounds to let you know that he's happy or upset, making short cooing sounds, moving both arms and legs together, holding her chin up off the ground when she's on her stomach, and open and shutting her hands and briefly bringing her hands together. You should feed your baby only breast milk or iron fortified formula until 6 months of age. Avoid feeding your baby solid foods, juice, and water until after 6 months of age. Feed your baby when you see the signs of hunger, such as putting your hand to her mouth, sucking, rooting, or being fussy. Stop feeding when you see signs your baby is full, such as turning their head away, closing their mouth, relaxing the arms and legs. If you're breastfeeding, feed your baby on demand. Expect to breastfeed around 8 to 12 times a day in a 24-hour time frame. They may need to feed more frequently during growth spurts. Generally, breastfeeding 2-month-olds, you'll be feeding every 2 to 3 hours during the day with a longer stretch of 4 to 5 hours at night between feedings. Give your baby vitamin D drops, which the recommendation is 400 international units a day, and continue to take a prenatal vitamin with iron. You should also be eating a healthy diet. If you pump, please make sure to store your breast milk properly so it stays safe for your baby. If you have questions, please ask us during your visit. If you are formula feeding your baby on demand, expect her to eat about 6 to 8 times per day. Typically, this is around 28 to 30 ounces of formula per day. Generally, babies getting formula will feed every 3 to 4 hours with one longer stretch at night, which can be up to 5 to 6 hours between feedings. Hold your baby while bottle feeding so you can look at each other and engage during feeding. This will also help prevent choking and promote a loving interaction between you and your baby. Always hold the bottle. Please remember never to prop a bottle. A rear-facing car seat should be properly secured in the back and should always be used to transport your baby in the vehicles. And this should be a rear-facing car seat. Never place your baby's car seat in the front of a vehicle with a passenger airbag, because airbags deploy with great force and this can cause serious harm to your baby. Car seats should only be used for travel and should not be used outside of the vehicle. Keep the harnesses snug around the shoulders whenever your baby is in the car seat. This will help prevent falls out of the car seat and injuring due to the harness. It is recommended that your baby sleep on her back in her own crib and not in your bed. The baby should sleep in a crib, bassinet, or cradle in the same room as the parents until she is 6 months old. Swaddling is not recommended after 2 months of age. Develop a schedule for naps and bedtime. Put your baby awake but still drowsy so he learns to fall asleep on his own. Infant irritability usually is caused by lack of sleep. It is normal for babies this age to continue to wake at night. Don't use TV or other digital media to calm your baby. Try other ways to soothe your baby, such as taking a walk, holding them in a carrier, decreasing the amount of stimulation and noise in the home, or a lot of parents choose to use infant massage. When babies are awake, they enjoy looking around their environment and moving their bodies. One of their first skills is to learn how to hold their head up. One of the best ways to learn this is through tummy time. Place your baby on a tummy for short periods of time during playtime. The recommendation is to do this several times throughout the day. Don't leave him alone on his tummy or allow him to sleep on his tummy. Tummy time can also prevent the development of a flat area in the back of the head. Do not drink hot liquids when holding your baby, and to protect your child from tap water scalds by the water being too hot, you should set your water heater to no more than 120 degrees Fahrenheit. Always check the water temperature to your wrist to make sure it isn't too hot. Your baby is getting stronger now, so always keep a hand on the baby when he or she's on the changing table, couch, infant seat, or bed. Sibling relationships. One of the best ways you can meet the needs of your older children is by making sure they're engaging them in the care of the baby. Have them bring supplies and hold the baby's hand are some of the ways that they can be helpful. It's important to set aside some regular one-on-one time with your older children also to read, talk, and do activities together. Please ask us any other questions during your visit.